Hello everyone, and welcome to this 5-minute lecture on unresponsiveness. This is Pei Chang. I'm an ICU physician. Today we're going to clarify some terms that are often misused for unresponsive patients, but they have very distinct medical meanings. Understanding these terms are pivotal for anyone working in a hospital. When we encounter an unresponsive patient, terms like coma, vegetative state, and brain death are frequently used interchangeably in conversation. However, these are actually very different medical terms. Knowing the difference is again absolutely critical for accurate prognostication and patient care. Let's start with coma. This is a state of unresponsiveness where the patient does not awaken and does not respond purposefully to any stimuli. Key features include no eye opening, no discernible sleep-wake cycles, and no voluntary movements. Importantly, the brainstem reflexes are still intact. This is either caused by damage to the reticular activating system or to both cerebral hemispheres. The prognosis is variable. Some patients can improve, some remain in coma forever, while some progress to vegetative state or even brain death. How about vegetative state? These patients can appear awake, but they do not have awareness. Their eyes can open, and they exhibit sleep-wake cycles. Eye opening can correlate with sleep cycle too. However, since they are unaware of the environment, they have no purposeful responses to the environment. Reflexes like blinking, yawning, or withdrawing limbs remain intact. Patients may even grimace, move their limbs, or briefly track their eyes, but again they lack consciousness. The prognosis is generally poor, although there's a small chance of recovery, particularly in cases caused by trauma. Some patients wake up decades later though. Finally, we arrive at brain death. This is the most severe condition. It is the irreversible cessation of all brain activity, including the brainstem. Patients have no consciousness or wakefulness, and crucially, no brainstem reflex, including pupillary, corneal, gag, and cough reflex. There's also no spontaneous respiration, which is confirmed as the positive apnea test. An electroencephalogram, or EEG, will show a flat line, indicating no electrical activity. Brain death is legally recognized as death in most jurisdictions. The prognosis for brain death is, by definition, irreversible. Now let's look at the case. Imagine a 55-year-old man in the ER after a severe car accident. He does not open his eyes. He shows no response to commands or painful stimuli. His breathing is regular, and he still has a gag reflex. He remains continuously unresponsive, eyes closed, with no sleep-wake cycles. Based on our definition, this presentation is consistent with what diagnosis? It's coma. Weeks later, his condition evolves. He starts opening his eyes spontaneously and has sleep-wake cycles. However, despite opening eyes, he shows no purposeful interaction, only grimacing or moving limbs without purpose, and his eyes might briefly track. Brainstem reflexes like blinking and yawning are still intact. His evolution points toward what? A vegetative state, yes. And he has wakefulness, but no awareness. In the next 48 hours, the patient's neurological status rapidly deteriorated. Now, he has no response to any stimuli. He has fixed and dilated pupils. He has no corneal reflex, and he now has a positive apnea test. His EEG shows flat line. This final irreversible state, with complete cessation of all brain activity, is the definition of brain death. To sum up, Here's a quick way to think about it. If the patient has no brainstem reflex, that's brain death. If the patient still has brainstem reflexes, then check for spontaneous eye opening or sleep-wake cycles. If the answer is yes to either of these two, then it's a vegetative state. If it's not, then it's coma until proven otherwise. This concludes my mini lecture. Please let me know if you have any questions or feedback. Thank you for your time.